Okay, the next topic is fever. Fever, obviously, we all know is just an increase of temperature most of the time due to the fact that there is an infection, even though sometimes that's not necessarily the case. But most of the time, obviously, because of an infection, it's also no pyrexia, which means obviously that there's increased temperature. Fever or increasing temperature is one of the signs that you're going to have a spot of inflammation. Again, right here it says exogenous pyrogens. In this case, this is because of infection. Endogenous is, for example, prostaglandin, as you can have in here. Several antipyretics that we take when you have fever. They work by stopping the metabolism of prostaglandin. Okay, so not much to talk about that in that sense. We have inflammation. I already spoke about it. Right, it has 4 cardinal signs, which are going to be, as you can see here, redness, swelling, heat, and pain. Right, that's basically what you need to know about it. Let's keep scrolling down. Obviously, the job of inflammation is to stop the infection by, as you can see here, mobilization of the body's defenses, containment, destruction of the pathogens, right? Most of the time, we talk about mobilization of defenses because inflammation is going to increase the blood flow to the area where you have the infection. This is actually called hyperemia. You have a very nice table in here where you have all the agents of inflammation as well as some of the cells and what they are going to produce. I would recommend you to pay attention to this table that you have right here with all the different chemicals that are part of inflammation. So when you have hyperemia, what happens is that you're going to have more blood, therefore allowing the white blood cells to reach the areas where you have the infection. And obviously, the moment that they allow the white blood cells to reach in there, the white blood cells are going to produce more chemicals that eventually are going to produce the migration of even more white blood cells, therefore fighting the infection and eliminating it from our body. Again, we have here cardinal signs of inflammation. We already talked about it. Containment and destruction. This is something that I'm not sure you need to know for this class, but might as well. I'm going to just talk about it just a little bit. There's one very important factor right here, which is, as you can see here, fibrinogen. Fibrinogen is going to basically start depositing around the area where the infection is, and it's going to form like a lake. The lake is going to be produced because the fibrinogen is going to be the borders of the lake, and in the middle you're going to have blood, obviously, and heparin is going to be released into this area where the blood is. Heparin is an anticoagulant, so basically you have a lake. The lake form in the borders of the lake are going to be the fibrinogen, and the lake is going to be obviously the blood, right? That is not going to be coagulating due to the fact that there's a presence of heparin in there. This is going to trap the microorganisms right there in this lake, therefore immobilizing them. They are not allowing them to move freely. And then obviously this is going to be good for our body because our immune defenses, such as all the white blood cells that we have, are going to go over there, and they're going to start fighting and destroying the microorganisms, not allowing them to move into other areas. Antibodies, white blood cells, and other defenses obviously are the ones that are going to destroy the microorganisms that are going to be trapped in this sort of lake. The most important one out of the microorganisms, the white blood cells that we have, as I mentioned before, is going to be a neutrophil. The neutrophil is going to phagocytize the microorganisms as well as the production of superoxide, hypochlorite, and hydrogen peroxide that eventually is going to destroy all these microorganisms. Unfortunately, as I mentioned before, the neutrophils are going to get destroyed as well. When you have an increase of neutrophils, obviously that's going to be called neutrophilia. Tissue cleanup and repair, basically that is the responsibility of the macrophages. As we said, monocytes are when they're inside the blood. Outside, they're going to be called macrophages. And you also have in the tissues basophils that have the same function as the you're also going to have basophils that are going to produce more chemicals. The macrophages basically go to the area where the destruction is, where the infection was, and they're going to destroy everything very much that is in the pathway that they're going to have. They're going to destroy neutrophils that are about to die. They are going to phagocytize dead neutrophils. They are going to phagocytize and destroy, dead bacteria, damaged cells. So basically, the macrophages are the ones that are in charge of clean up the area where we had the infection. The macrophages, obviously, they're going to perform this kind of cleanup of that area. Okay. So if we keep scrolling down right here, you have in there the barophages and neutrophils and the macrophages, which I already spoke about. So the repair is going to start, obviously, because the platelets are going to provide platelet-derived growth factor that eventually is going to stimulate the fibroblast to produce more fibers in order to repair the area that was damaged due to the infection. So that's just a general information about it, and that's about it regarding this topic. The next topic is going to be general aspects of adaptive immunity. This is basically the one that relates to the immune system, the specific part of our immune system. Remember that we said that there are 3 different levels: level 1, level 2, level 3, right? We said the first 2 are non-specific, such as the skin, but the third one relates to the immune system, the area where we need to talk about antibodies, as well as cells that we have here. So let's start with this. Obviously, immunity in this case, this type of immunity, I should say, is specific. And, why? Because it's going to provide you specificity as well as memory. Specificity due to the fact that the antibodies that we're going to use in here, they're going to be specific for certain type of infections. The antibodies that defend you against poliomyelitis, for example, are not going to be able to defend you against the flu virus. Memory, because obviously once you've been infected with this microorganism one time, this type of immunity is going to give you memory. So the second time that you got the same infection, you don't even feel that you have the second infection, because the response is going to be so fast that you don't have any type of signs and symptoms most of the time, and that is provided by the memory. So you should not forget that in this type of specific resistance, we have specificity as well as memory. Okay. We keep scrolling down, then in this type of immunity, the specific immunity is going to be based on 2 types of immunity. One is going to be cellular immunity. Obviously, this one is the one that relates to the cells. Basically, we need to talk about in here lymphocytes. How many types of lymphocytes we have? Lymphocytes T and lymphocytes B. We need to talk about these 2. Basically, for that third line of defense, the one that is specific, we don't talk that much about the eosinophils, neutrophils. In this case, is basically lymphocytes T and lymphocytes B. Humoral relates to the part of the immunity that uses antibodies. Okay, so you remember cellular, obviously that's very obvious. That is the presence of cells that we're going to have in this type of immunity, and humoral is the one that relates to the antibodies. Okay, let's keep scrolling down then, and then we're going to see in here that we have, based on the way we produce our antibodies, we have that there are different kinds of immunity. One of them, the first one that we have in here, is natural active. So natural active refers to natural. You got the infection on your own. Nobody gave it to you. You got it on your own because, unfortunately, you got infected with something. And active relates that you created your own antibodies against this infection. So natural is because you got your own infection. Active because you created your own antibodies. Then you have artificial active. Artificial, you did not create, you did not get your own infection. You got the infection artificially, like for example with a vaccine. And you are active because you created your own antibodies against this infection that was given to you with a vaccine. So that's why it says in here vaccination and vaccine. We keep scrolling down. We have the next one, which is natural passive. So natural means that you got your own infection. Passive means that you did not create your own antibodies. In this case, your mom created the antibodies and your mom gave you the antibodies, when she breastfeed you and you were a baby. Okay, the last one that we have in here is artificial passive. So in this case, somebody else got the infection, somebody else got the antibodies, and then doctors get the antibodies from this other person, and they give these antibodies to you because you have the same infection that this other person got. So that is artificial passive. You did not create, you didn't get the infection, you didn't get the antibodies, you just got the antibodies that somebody created and they give that to you. So that way we know that we got an infection, right? And that way our body responds. And the microorganisms that are going to cause infection, they are going to have antigens, right? Antigen is a molecule that triggers an immune response, as you see right here. Not all the microorganism is the one that causes an infection. Only certain regions of these antigens are the ones that are going to cause the infection. And these regions in the antigen that cause infections are going to be called epitopes, as you can see in here. You see it says in here, only certain regions of an antigen produce infection, and those are epitopes. There are some other molecules. I didn't think you need to know that, but it's right here. It's haptens. Haptens are molecules that they are so tiny that they cannot create an immune response on their own. However, if they bind to a macromolecule or a molecule that is bigger, they create a macromolecule that now it can create or stimulate or initiate an immune response. So basically, a haptens does not create an immune response on its own because it's too tiny. But the moment that it links to something else, then obviously creates an immune response. Okay. We scroll down, we have lymphocytes. As we said, we have two main kinds of lymphocytes, lymphocytes T and lymphocytes B. The main job of the lymphocytes T is basically to destroy the antigen. The main job of the lymphocytes B is basically to create antigens that are going to flag the microorganism with the antigen. So lymphocytes T destroy. What do they destroy? The microorganisms that were flagged with the antibodies created by the lymphocyte B. Okay, so then you have here the lymphocyte T. All the lymphocytes, like any other white blood cell, is created in the bone marrow. From the bone marrow, it leaves and they will go to different areas. For example, the lymphocyte T will go to the thymus. T with T. T lymphocyte to the thymus. In the thymus, the lymphocyte T is going to mature. Basically, it's going to learn to identify the different type of microorganisms that they may infect us. Therefore, learning how to fight these type of infections. Okay, I see other information in here. Okay, it's not critical for you to know this, but the lymphocytes T, once they're in the thymus, they learn to identify these antigens. However, not all of them are able or capable to do that. Why? Because of different type of problems that these lymphocytes T may have. So therefore, in order to be able to fight the infection, they have to become immunocompetent. Basically, that means the ability to recognize the antigens. So what happens if they don't recognize the antigens? That they are just going to be either destroyed or they are not going to be used, and that is called by negative selection. Again, you don't need to know that much information, so you just need to know that lymphocytes T go to the thymus, and that's where they go and mature. That's where they become immunocompetent. Okay, but you have to remember that not all of them actually become immune competent, so a lot of them, they don't work. So if we keep scrolling down, right here, you have the same information. You see, tells you clonal deletion, energy, self-tolerance. This is the one that is talking about those lymphocytes T that they don't work, basically. Okay, they are just going to be either destroyed or they're just going to live in the blood without doing basically nothing. Okay, so you don't need to know much information about that. That's why you have in here positive selection to form clones, because obviously the ones that start working, you need to clone those because those are the ones that work. There are not that many. Well, right here they are showing, you see it's only 2%. Not that many, but that's enough for our body to be able to defend itself. The next one is obviously lymphocyte B. I already told you the main job of the lymphocyte B is to produce the antibodies. Lymphocyte B produce antibodies. Antibodies have the ability to bind and identify antigens, and once they bind and identify the antigen, this particular antigen is going to be flagged to be destroyed. That's when the lymphocytes T come to play and they destroy this microorganism.